Our next keynote is from Dr. Dan Gebremedhin, who is a partner at Flare Capital, which invests in behavioral health technologies. Dr. Gebremedhin also serves on the board of Flare portfolio companies such as Eden Health and Somatis. He previously spent 8 years as a practicing internal medicine physician, as medical director at Harvard Pilgrim Health, and then as health policy advisor for Governor Charlie Baker. So please join me in welcoming Dr. Gebremedhin.
Thank you, Laura. I appreciate that. Great to be here today. Really appreciate you guys giving me the time. Who am I? I think Laura gave a really nice intro. I work at a Boston-based venture capital firm called Flare Capital. We only invest in healthcare technology and services. So, one component of that is we've made one behavioral health investment, but we invest across the healthcare landscape and software and services businesses. We are investing out of our second fund. It's a $255 million fund. Our first fund was a $200 million fund. So we manage a little under $500 million in assets. One of the other unique things about our fund is that most of our capital was raised from some of the largest healthcare corporations in the country, large payers, large provider systems, some pharmaceutical companies, some lab companies, some device companies. So we have a really strong perspective on what large enterprises are looking to accomplish in the healthcare industry. As Laura mentioned, I've been at Flare Capital for about 5 years. So I've been a venture capital investor for about 5 years. But before that, I worked at a health plan. I worked at the Harvard Pilgrim Health Plan, where I ran value-based purchasing. And so contracted with a number of different vendors. Vendors can sometimes be doctors, sometimes they can be technology companies. And so always was assessing the value of new technologies for our population. One of the areas that I've spent a lot of time in the last 5 years is in this behavioral health market space. We've made one investment. It was a recent investment that we actually made earlier this year. It's an early stealth stage company focused on providing both digital as well as telephonic or televideo types of treatments to targeted behavioral health conditions, initially starting with suicide, but have looked at probably 30 to 40 different investments in the behavioral health space. And so wanted to share some of the lessons that I've learned in how you actually move from an idea or a piece of evidence or a product to an actual business, and how you actually commercialize behavioral health technology. Next slide. So there's been significant, funding traction for behavioral health technology over the last, I would say it's picked up over the last 5 years since I've been in venture capital. Funding can sometimes be a marker for success. It isn't always a marker of real revenue. And I say usually funding will precede the actual revenue. A company will probably raise anywhere between $2 and $5 million before they actually collect any actual revenue, just because sales traction can be quite challenging in the behavioral health market space, depending on who you're actually selling to, whether it's a large enterprise like a payer or a provider system, or you're going direct to consumer. That said, there has been a significant increase in awareness around the needs for behavioral health. A lot of that has been, I think, attributed to what's happening in the pandemic, but you can actually see that there actually was a significant increase over time, as a lot of the data has been shared broadly about how behavioral health can not only impact one's mental health. Behavioral health can also impact kind of medical health and medical costs. And I would say that that's really what's driving a lot of the adoption that we're seeing in the market. So commercializing behavioral health tech. So how do I think about this? I don't know that there's a very defined playbook on how you market a product. That said, these are the types of things that we think about as venture investors when we're looking at an early stage behavioral health company and whether or not we should be investing. I think the way that I like to think about it, it's about asking the right questions. And so in each of these areas, product value proposition, business model, market dynamics, and team, I'm going to list a series of questions that venture capital investors ask to the entrepreneurs. And my advice to entrepreneurs is before you meet with, any, investor, you should be asking yourself these questions. You should prepare yourself for these questions because ultimately that will inform how you build the business. And ultimately that will, I think, be directly proportional to, the amount of, business you can actually generate, the amount of revenue that you can generate for your product. Assuming that, it does have the evidence base behind it, because my sense is this is the audience that we're talking to. So the first piece is business model. Again, this is central to developing business. And I understand that some academic groups may have a product. They may not want to start the business. They may want to license it. But ultimately, whoever ultimately markets that product in the market, you're going to have a real thoughtfulness around your business model. And so what I've tried to do in each of these areas is list the questions that we ask ourselves, but then also share actual examples from behavioral health tech companies and maybe share some stories. I've looked at most of these companies, and if I haven't looked at these companies for investment, I know some members of the team are the actual acquirers of these businesses. So business model, how does the company generate revenue? What is the product that they're selling? Is it a physical hardware device? Is it a piece of software? Is it telephonic services? And then secondly, what is the reimbursement strategy? How are you going to get paid for that product or service? Are you going to get paid from an enterprise like a health plan or a provider group, or are you going to go direct to consumer? Secondly, how are you going to get paid? Are you going to get paid on a population basis, meaning are you going to get paid on a per member per month basis? Are you going to get paid on a transaction basis every time someone uses your product? Are you going to get paid? Or are you going to go direct to consumer and require a subscription? So consumers will pay $99 per month for access to your services. These are all super important questions to understand before you actually enter the market, and make sure that there is true alignment there. I'd say another important question is how are you going to actually reach your customer? What's your distribution strategy? If you're working with large enterprises, it may not be so effective to go direct to each of these enterprises. You may want to work with a channel partner. You may want to work with another company that is already selling products into that channel and kind of piggyback off of all of their existing relationships. If you are going direct to consumer, I think you have to be quite thoughtful about how are you going to reach the consumer? Are you just going to do digital media? Are you going to do search engine optimization and digital acquisition? And because there are certain costs that are associated with each channel in terms of how you plan to reach your customer. It's also important to understand, who wants your business to succeed in the market, who doesn't want your business to succeed in the market, and therefore you want to partner with entities that want to actually see your product succeed in the market. And then I think it's super important to understand, where does your product sit within the overall ecosystem of the delivery of behavioral health? Are you dependent upon another product or another company in order to drive utilization and adoption? And then also, we'll talk about product value proposition in a second. It's always going to be super important to understand, how are you generating value for your ultimate customer? And a great example, of a lot of these things distilled is Able2. It's a company, that's been almost around for about 10 years now. They've raised over $50 million, or roughly $50 million in venture capital. They've achieved a great valuation. Optum United Health Group, made a quasi acquisition of this business that targeted their valuation at around $450 million. And they're doing, in the range of $40 to $50 million in revenue. So a very, very successful behavioral health tech business by any stretch of the imagination. And I think the beauty of what they did was, they had a case rate transaction based business model where they got paid every time they delivered a service to a customer, and they worked with their customers, which were payers and ultimately providers and employers, to actually target patients who had medical conditions who were not currently receiving behavioral health, and they provided CBT telephonically to these populations. Continuing product value proposition. it's super important to understand that there are a lot of problems out there in the market, but not every problem, necessarily uh, will be paid for in order to be solved, right? Is there a willingness to pay? And so it's super important to understand who is your customer. The customer may be an enterprise, and who is the end user? The end user may be a patient. And so it's the actual customer, the large enterprise, that is purchasing the service, but it's the end user who is actually using the product. And you need to ultimately understand, how do you drive adoption and utilization by that end user that ultimately delivers value for that end customer. And a great example is the business Talkspace. Talkspace is a text message-based therapy company, and they've expanded. They provide telehealth as well, but they initially started text message therapy. We actually looked at this business for potential investment. They started direct to consumer. They started providing, a subscription-based text message, quasi CBT therapy to populations, and they were charging anywhere between $50 to $200 per month. And we spent so much time at the time, and this is 2016 when we looked at this business, looking at the evidence basis. Is there data that suggests that text message based CBT is as effective as in-person CBT? And when we looked at the data, there were some studies that supported it, some studies that didn't support it. When we talked to experts in the field, they equivocated. They said, oh, maybe it is, maybe it isn't, not sure. But that was the wrong question to be asking. Patients were paying out of pocket $100, $200 a month to access this service. And in retrospect, we looked at the business when they were doing $6 to $7 million in direct to consumer revenue. Now they're doing well over $30 million, in direct to consumer revenue, and they've expanded to employers and payers. And so, usability, adoption, and whether or not the patients and the end users actually like the product, to me, is actually more important in commercializing a product as opposed to the evidence base. And again, not to say the evidence base isn't important, but in commercialization, it's, will your customers and your end users use the product? Market dynamics, as I flagged earlier, a lot of dollars coming into this space, a lot of companies being started. And so it's super important when you come to market to understand who else is in the market. How are you different? Which I think is probably the hardest thing, I think, sometimes to articulate, is this concept of differentiation, when a lot of the tag phrases, a lot of the marketing sounds very, very similar. One of the things that, we also think about before we, ever make an investment is that ultimately, who buys this company, right? Ultimately, how do the investors kind of get their money back? They need to sell the company or it goes public. It's relatively rare for a lot of these companies to go public. Usually a larger company will acquire that company. And so it's always important to understand what's missing in the market. Where are the gaps in the market today? And if you're able to, effectively and succinctly fill one of those gaps, a much larger company may want to acquire that, because they are always facing what is called either a buy or a build decision. They can either buy a product and solve that problem, or they can build it themselves, which oftentimes requires a lot of capital, requires a lot of time, and may not even be successful. And so just two examples of companies that I think took different paths here: MyStrength and Lantern, both venture-backed digital, CBT, cognitive behavioral therapy companies. MyStrength raised less capital, 6 million, but actually had a better outcome. Lantern raised, roughly 20 million. MyStrength was acquired by Livongo, which ultimately was acquired by Teladoc, for roughly 5 times the amount of capital that was invested in the business. Whereas Lantern, unfortunately, shut down operations in 2018. And I think, MyStrength was very capitally efficient, had a strong, base of customers kind of in the self-insured employer category, whereas Lantern, who was partnered with UPMC, the large Pittsburgh-based healthcare system, was trying to sell a lot of health systems and ultimately wasn't able to get a lot of traction. And unfortunately didn't build a lot of partnerships along the way, as I flagged earlier, and they had to shut down their operations. That said, there was still an asset there in terms of digital CBT, and they continue to license that to other technology companies, but unfortunately the investors didn't really make money here. And then finally, team. Oftentimes, one individual person, one individual entrepreneur isn't going to have all the skill sets that are required in order to get kind of commercial traction. And so we always advocate, it's not just about an individual entrepreneur, it's about a team. Entrepreneurs should surround themselves with individuals that complement their skill sets. You should, certainly, kind of do your research on who these people are, understand, what skill sets you need, and then understand, who in your network has these skill sets, but then also back channel and get a lot of references around these people. We generally like to invest in teams that have experience, executing on the path that the company is looking to, execute upon. So, if you are a behavioral health technologist or clinician and you have this idea for a new product, I would surround yourself with people who have sold into whichever segment of the market you want to sell into. Have product people who have built product that ultimately is delivered to those sets of customers, and ultimately that's how you kind of get the best outcomes. And Quartet is an example of a company that has raised over $150 million in venture capital, and they have former investors, former health tech operators, and former health plan operators all on the team, which has had to lead to a lot of success that they've had in the last few years. And so just wrapping up, I think it's all about internal consistency. If you are looking to commercialize a piece of behavioral health technology that has strong and evidence basis, think about these other factors, bring them all together in an internal consistent model. And from our perspective, we think that you'll have a lot of success. Thank you.